This is a post-workshop spontaneous interview from Laura Beck, whom we demonstrated on, and this is a workshop presented by the Hesch Institute on treating the whole body. Thank you, Laura.
Yeah, thanks for having me, Jerry. So what we examined on me was that my posture was very poor. We were talking about my thoracic spine, and just my overall body was very rigid, starting with the thoracic spine, and then my pelvis was very rigid. We took a look at my neck, we took a look at my feet, just doing some very simple motions of my ankles totally changed the way my neck moved, and then mobilizing my ankles, both my subtalar and my talocrural joints, totally changed my gait and then changed the way my neck moves more. I feel like my posture is so much better than it was yesterday compared to today when we were treating me. My thoracic posture is improved. I'm no longer hanging in an anterior pelvic tilt at all times. I have a ton more range of motion when I'm walking, and just overall I feel lighter, and I'm extremely thankful for being here as a student to learn things to take back to my primarily neuro caseload, and I'm very thankful to have been treated by Jerry. Thank you.
I made a comment about your neck earlier. Was it yesterday?
Both today.
Okay, and then
Yep.
just a while ago I made a
Yeah.
comment, and what was that?
The comment earlier was that my neck felt a little funky. It was a little too hypermobile. It was a little worrisome for both of us. I was having apprehension, having it tractioned. And
What was interesting is that you weren't really aware of that. You didn't really articulate it when I asked you, but you clearly were apprehensive.
Yeah.
So we had a dialogue about that, and it felt remarkably elastic. It intimidated me. It felt unstable. But what I wanted to do was see if we could affect it, not by working right there, because that would have been very intimidating.
Yes.
Because it really truly felt unstable on the long axis, with traction directed at the upper cervical. And so we found other areas in your body to work on that reflexively inhibited stability up there. And the body does function as a unified whole. Every time you hit heel strike on one side, the upper cervical rotates that way a little bit, and on and on and on. The body is a functional integrated system, and I'm so grateful that we were able to find ways of making an entry point and alter that. And now when I tested your upper cervical, it felt distinctly better.
Yes.
You could feel that
Yes.
difference, and
Yeah.
I'm much more comfortable at this stage. The workshop is over and your upper cervical is now stable, and you have greater freedom of mobility throughout your T-spine, throughout your feet and ankle. And it's not common knowledge, so of these relationships. And but I'm grateful for the opportunity to treat you and to demonstrate with you and show the value of a whole body integrated approach.
I saw my husband at lunch, and he commented on how I was no longer hanging, I was no longer hanging in my thoracic spine or my anterior pelvic tilt. He actually commented unsolicited about my posture.
So he's one of these husbands that notices.
He
so
is.
If you get your hair done, he notices it.
Yes.
I'll have to train from him.
Thank you.
Thank you so much.